Hi guys, this is Dr. Shamima Sattar from the YouTube channel Doctor to Help. Today we are going to start a skin disease series. The purpose of these videos are just for you to identify that there is a skin condition going on so you can treat it quickly, because these are very hard to treat once you get it. It takes 3 to 4 weeks, sometimes even years to treat them. So you want to identify it quickly so you can treat it, and you also don't want to share it with your other family members. So the first video today we are making it is on tinea. It's a fungal infection, and this is fungal infection of the skin. Depending on which part of the body is involved, there are different types of tinea. If it happens in your foot, it's called Capitis. If it happens in the nail, it's tinea unguum. The other name is onychomycosis. If it happens in your groin area, it's called jock itch or tinea cruris. If it happens in the trunk of your body, it is called tinea corporis. And if it happens in your scalp area, it is called tinea capitis. Think about capitis. Okay, so let's first talk about tinea pedis. This happens on the foot. It can be scaly, it can be erythematous, and it can be itchy. It can happen in between the fingers. It can happen on the sole of the foot, or on the medial side, or the inner side of the foot. Yes, it can happen in all these three areas. Very important, you do not want to transmit this to your other parts of your body, especially tinea cruris or the jock itch. If you wear clothes, you are wearing it over your feet and then putting on, suppose your underwears or underclothes, you can spread it to other area of your body. So very important, if you do have tinea pedis or tinea unguum, it's a good idea to have some socks on and then put on your other clothes. Pull it on top of it so that it does not spread to your groin area. Very, very important. So we will talk about treatment at the end. The next one we're going to talk about is the tinea unguum. That happens when the tinea infection happens in your nails. If it happens in your nails, remember, all these tinea infection, they are targeting the protein in your skin, hair, and nails. So it's the protein that they are metabolizing. So what they do is they scrape away the nails of your toes, and they can also leave some debris underneath, and the nail can look pretty yellow and brittle. So this is tinea unguum. It's very hard to treat. Next, we're going to talk about tinea cruris, or commonly known as jock itch. It happens in the groin area, and it happens in centrifugal way. So it starts in the medial thigh and then gradually spreads outwards. This can be elevated, well demarcated, erythematous, and very, very itchy. Happens in the groin area. Why does it happen in the groin area? That's where we are more, we have more sweating. It can happen from excessive sweating. It happens more commonly in men rather than female. Those people who are prone to it are, like I said, men, more common than female. Obesity, diabetes, immunosuppressed condition, like somebody on chemotherapy, somebody who has different kind of immunosuppressive treatment ongoing, and those who are on immunologic suppression due to organ transplant, they are going to be more prone to these infection. So very important, please wear some loose clothes, cotton clothes, so there's good aeration in that area. One of the things that it can be confused with is the candida infection. Now the candida infection will be more moist looking, and it usually can also occur in the scrotum. Tinea cruris will usually spare the scrotum, and it is more dry and elevated. And the candida can happen where there's friction, rubbing of the skin. So it doesn't have to be in a centrifugal way, like in the center spreading outward. It doesn't happen that in the candida. That's a distinguishing factor. So friction area doesn't happen in centrifugal way, and it can look moist. These are the three factors for candida, and usually it will also occur in the scrotum area. Next, we are going to talk about tinea corporis. This is the commonly named as ringworm. as it sounds like, it is circular or oval. So the lesions look typically round or oval. It doesn't have to be totally round. Usually starts in the center and gradually gets bigger. Those lesions starts in the center and gradually gets bigger. When you start noticing it, please pay attention. As soon as you see it, you want to be careful because it can spread even more. So you can use topical antifungal, and please wash your clothes in the washer dryer. Do not share any kind of clothing, hairbrush, and personal items with any other family members, because from the clothing you can give it to another person. You want to wash it with warm clothes. Also, another thing to remember, not good to take hot baths. You want to avoid hot baths. Always good to wear cotton, free aerated clothes that are well aerated. All right. So Tinea corporis, we talked about the ringworm. Circular, centrifugal, starts in the center, gradually gets bigger, itchy, and it has a demarcation in the oval area and the borders. All right. Next, we're going to talk about the scalp, the Tinea capitis. It happens in the scalp or cap area, and that's why it's called capitis. You can see some scaly area and areas or patches of hair loss areas. So when you see that, different places of patches of hair loss with the scaly look around it, that's usually Tinea capitis. Now, we talked about how do we diagnose. Mostly it's clinical. If you have a difficult situation where the over-the-counter is not taking care of it, there's a lot of azoles that you can use for treatment topically, and it can be found over the counter. So if those doesn't help, it usually takes about 3 to 4 weeks, by the way. Even after all your symptoms goes away, you want to continue for another week. So you want to definitely continue for at least 1 month, 4 weeks. And only 2 occurrences you need oral treatment. If the topical is not working, guess which one? The 2 extremes, the Tinea capitis and the Tinea pedis. Tinea pedis, as in the Tinea unguum, not the pedis, I'm sorry. That's a boo-boo. It is the nail fungal infection that is very hard to treat. So you always want to use or topical antifungals first. If that doesn't work, you go to oral, especially for Tinea capitis and Tinea unguum. All right. Sorry about that boo-boo that I did. We are talking about oral treatment only for the unguum, not the pedis. All right. So these are the different areas of tinea, and we do if the diagnosis is questionable clinically, you can always do a KOH preparation, and you will see the segmented hyphae under the microscope, and that's how you officially diagnose this. All right. Before you start any oral antifungals, please talk to your doctor. Some of this medication can cause liver toxicity, so you definitely want to make sure you do all your basic labs, make sure your kidney and liver functions are doing well before you take any oral medication. Topical fungals usually are available over the counter. You can start with that. That doesn't help, go see your doctor and ask for help. All right, remember, these are very contagious. You do not want to share any personal items. Tinea pedis can be even shared on infected ground, especially wet area like shower stalls, athletic activities with your partners, with your friends in close circulation, like in a football team or soccer team. You can also spread because you are sharing that same area and exchanging in the shower stall area. So be careful in those cases. It is very contagious. You want to be careful. If you have any questions, please leave a comment down. If you like this video, please click subscribe and like so that I know that it is helpful. If you find something that is not helpful, that you did not like, please leave a comment so I know I need to correct it. All right. Very nice talking to you. Thank you for joining me today. And those who are participating in treasure hunt, please look for that question. All right. We'll see you next video. Take care and thank you for listening. Bye-bye.